I want to turn back over to Sue, and just wondering from the Alliance, are there specific resources that you would like to highlight or draw attention to that others would benefit from during this time?
Sure. We have been working quite a bit with the National Association of Area Agencies on Aging, and there are more than 600 area agencies across the country. And underneath all of those agencies are things like the senior centers and Meals on Wheels. And we worked with them on a resource that we would love for folks to download off our website, which is agingresearch.org. And the resource is called Staying Safe at Home During the Pandemic. And it includes reminders about symptoms to look for and resources to go to. And we did it in partnership with them and also with the Elder Care Locator, which is another great resource for families. If you're looking for information in your local community about how to get in touch with Meals on Wheels, or just to ask if you could get some friendly phone calls, because that connection is so important. And there are volunteers at the local level that are doing friendly phone calls. Elder Care Locator is a free service of the Administration on Community Living, which is a federal agency that's part of the Department of Health and Human Services. And the number is 1-800-677-1116, 1-800-677-1116. And you can ask about local resources in your area. And another thing that we're doing in working with these agencies is to try to fill the gap in volunteering, because they have lost a good amount of volunteers, because many volunteers are retirees themselves. So we're working with a variety of healthcare companies, and we're matching them up because they have folks that are, maybe working more part-time or aren't able to do what they usually do, and they're getting paid, but, looking for ways to help at the community level. And we're linking them up. So if you are with a healthcare company or you have available time to volunteer, please email us at info@agingresearch.org, and we'd be happy to link you up so you can volunteer. Because, you hear from this program, there are just fabulous people out there, and they're just yearning for that connection. So for very little time, you can really get a lot of gain from helping others out.
Thank you, Sue. So I want to come back to Jackie, and I want to have a discussion now that's a little bit broader than just about COVID, and really more about how individuals can connect, particularly during this difficult time. We've talked so much about this. We've talked about how connection is so important to Dementia Action Alliance, how it enhances the meaning of people's lives. Jackie, can you tell us how folks right now can connect with Dementia Action Alliance?
Sure, thank you. The first thing that I want everyone to realize is that what we care about most is what matters to the person and the family most. So, for example, I always encourage people who want to learn more about DAA. Of course, first I encourage them to go to our website, because they can go to our Resource Center tab, click on it, and there's an entire page of windows. So you can go to videos, you can go to books, you can go to reports, just to get a sense of what you might be interested in. Then I would say, please contact me. My email is jpinkowitz, all lowercase, @gmail.com. And the reason I want them to contact me is so I can arrange a personal conversation with them to really understand what they might be interested in. We have, so many different groups that they could get involved with. We have one that's focused on the arts, and it goes from everything with guest speakers sharing and engaging across the whole spectrum of painting and writing and horticulture. We have another group that's focused on technology, as I mentioned before, and companies with new apps and technologies, they come on this group and they want to get feedback from individuals and families living with dementia. So that's something that's very meaningful. The third one is optimizing well-being. And in this particular case, when we are all kind of having some issues going on with a lot of other people, including some professionals who really understand that well-being is so much more than physical health. Well-being means enhancing your social, emotional, psychological, and spiritual health. And so that's a very, very interesting one. But I really like talking to the people because one thing that DAA recognizes, and it's been very sad for me for this whole journey, because I was a caregiver to my mom, and I was always so unhappy that nobody seemed to understand or want to know who Dorothy was. And there was so much to Dorothy. And because of the stigma, they ostracized her from her community, as they did others. And I decided that that doesn't make any sense to me. I know, because I'm a special education teacher, that every single person across the globe is differently abled. Every single person has talents and interests that only they care about. And so the whole notion of DAA is to come together and say, not what I want you to do, but what matters most to you. What would you like to do? And that, I think, Eli, is the beginning of finding some nice pathways of opportunities.
Thank you so much, Jackie. I really do hope that folks begin to reach out to you. I hope your email inbox is completely flooded within the next couple of days. Thank you for that. Sue, turning to you. Obviously, this pandemic threatens to consume conversations about healthcare, broader discussions around healthcare. What are you and the Alliance doing to ensure that aging-specific issues are discussed? And what do you see as some of the key priorities for that discussion?
That's a great question. And it is true because there were a lot of discussions about costs of healthcare that were going on prior to the pandemic. And the pandemic is really sort of bringing a lot of these issues to light because, not everything is going to be automatically covered. You might be able to get your testing, but the hospital care, the convalescent care after that, it's raising a lot of those questions. So we're trying to bring attention to that. We're also bringing attention to the way that we evaluate healthcare in this country. I think this whole pandemic has brought up a lot of issues around healthcare rationing, and it's kind of revealed some of our discriminatory views towards older adults, towards minorities, towards people with disabilities. And we have been working on state rationing issues as these plans have come to light and have revealed restrictions when there are healthcare shortages based on intellectual disabilities or cognitive deficits. Some frankly kind of barbaric, concerning things. But we see these as opportunities to remind all of us about who we are as a country and who we want to be after we get through this. And, you keep hearing this sort of mantra that we're in this together. And I think raising these issues is really important right now. This is a moment when we're all kind of hypersensitive to what's going on. And so it's a good opportunity to recognize that not everybody has the same access to things. And it's revealing disparate healthcare disparities for people of color and some of the attitudes that we have towards certain groups of people in our society. And I think that we all need to take this opportunity to look at the nursing home care system, to look at healthcare access issues, to look at costs of healthcare issues, and think about where do we want to go as we get through this and after we're done, because that's really going to be revealing of who we are. And I'm hoping that we're able to sort of come together around these issues and make some real significant system-wide changes to the way that we all care for each other.
Thank you. So we really appreciate the work that you and your organizations are doing. You've raised some great issues that are of concern. And the last question I want to ask you now relates to that. Obviously, during this time, there's a great deal of anxiety. How can you not experience this right now? But I want to ask you all at this point in time, while it's easy to find reasons to be anxious and concerned, where can we find hope? What we're really trying to do through this series is build that sense of community and hope in addressing these anxieties. We're going to get through this, and hopefully we're going to come out better and stronger. So I really want to focus in right now on what's giving each of you hope right now for this community during this time. Jackie, do you want to begin?
What gives me hope right now is exactly the same thing as what has given me hope from the moment DAA began. And that is that we understand that there are so many wonderful individuals and families living with dementia, and they don't want to just survive. They want to live and thrive and be included for all of their talents and abilities. And I truly know that the only way we can do it is together, because together we can create dementia-friendly places and spaces and attitudes online, across our nation, across the world. I keep a quote from Maya Angelou in my office so that it reminds me all the time. And this is what she says, and I think she's absolutely right. Do the best you can until you know better. Then, when you know better, do better. And that's what gives me hope, Eli.
Thank you, Jackie. Mark, Brenda.
Okay, let you go first. What gives you hope?
It wasn't easy getting dementia. If you talk to many people, they're angry, they're mad, they throw fits, cussing and swearing, and I'm one of them. But it didn't stop me to go for counseling and keep trying to find something new or the edge that would make me back to what I was, a loving husband and father, and a man that cared about other people. I always have went and done things for a lot of different people, and when they were struggling and stuff. And so I'm back to that and a little bit better. That's why I look at it. And I'm just, I know the pandemic is a horrible, horrible thing, but I've taken the outlook of the blessings that I have had and the good things that has happened to me to encourage me not to get depressed over all this. So I have those type of things that I do to make things workable and satisfying.
Okay. What gives me hope? Being creative and doing things with a little different twist gives me hope. Another thing is just people. Oh my gosh, there are so many good people in this world. And if we can just focus on people, and I mean, the people here in this group and trying to help others, so just people give me hope. And then the other thing is, this is a little different than hope, but something that I think will be ongoing is we're all now experiencing social isolation. And when it stops, the social isolation for people living with dementia is likely to continue. It was there before the pandemic, and it'll be there after the pandemic. So I think after this is all over, people will have a new empathy for people living with dementia and the social isolation that it brings. And then I know that Mark forgot, so I'll say it for her, because I also know that a source of our hope is our faith.
Right.
Right. So our faith and our spirituality.
Thank you so much, Mark and Brenda. And Sue?
There's a lot that gives me hope right now. I think that this is an unprecedented time of collaboration in healthcare. It's really inspiring to me to see companies working across each other, working across country borders. There's an international effort to find a vaccine, to find effective treatments. And it's really inspiring to see that. And I hope it continues after we get through this, because that's how we're going to accelerate research, is by working together. So that gives me great hope. The other thing that gives me great hope is I think that when we go through such, difficult times like this, it has an equalizing effect to a certain degree. We're not at our best. And that allows us to be a lot more real. It sort of forces us to be a lot more real with our fears, with our needs, with needing to ask each other for help. And in many ways, that's a good thing. If we can come out of this leaning on each other a lot more, I think that we will have learned something very significant. This is hard. There's a lot of loss. There's fear, but I think that when we are sort of getting out of ourselves and trying to help other people to the best of our abilities, we can see how connected we are. And that gives me tremendous hope.
People are connecting, and that has filled me with tremendous hope. And my wish is that viewers of this video series will also come away with that sense of hope. So I want to thank each of you for your time today. Thank you for the great stories you shared and the resources that you helped bring to light today. We're very much looking forward to connecting with others as this series continues in order to bring that hope and those resources to the folks who desperately need them. So again, thank you for all of your time. Greatly appreciate you. Take care.